Public schools openings push back a few weeks. COVID cases continue to rise, and the government's eyeing new CDC recommendations. Good evening, everyone. I'm Leah Cooper with your JCN News for this Wednesday, December 29th. The reopening of schools has been postponed due to the hike in positive COVID-19 cases. This much coming from Minister of Health and Wellness, Dr. Michael Darville, during a virtual press conference this afternoon. Public schools were set to reopen during the second week of January 2022, but plans have changed.
We have decided to postpone the opening of schools for an additional 2 weeks as the Ministry of Health epidemiological team assess the data that's coming in. It is not, in our view, a good thing to open schools in the middle of a pandemic, and so we have decided to wait and act with a degree of caution to ensure that we open, and when we do open, we open so that we can stay open.
Minister of Education, Technical and Vocational Training, Glennis Hannah Martin, was also present and says that she and her team have really been pushing for schools to reopen.
Children have been out of school or in a, not out of school, but in a virtual mode for many, if not all, and challenging for some, really challenging. And so we have been trying very hard to get schools open. We have accelerated our contractual works with the construction through Ministry of Work. The schools are all poised to be ready to reopen, and unfortunately, we will not be able to have children in on a face-to-face basis, teachers, and however that will work, and on the 11th, for students on a fully virtual basis.
Minister Hannah Martin noted that the virtual learning will continue until they are advised otherwise by the Ministry of Health. She says that it is a very challenging time for education in the Bahamas, and they are seeking every possible avenue to stop the disruption of education for children in the country. Meantime, COVID-19 cases still trending in the triple digits. The Ministry of Health and Wellness confirming 159 new cases on Monday, December 27th, with 65 cases confirmed on Tuesday, December 28th. A combined total of 1,048 RT-PCR tests were conducted between Monday and Tuesday, resulting in 209 confirmed cases here in the capital, 9 cases on Grand Bahama, 8 on Bimini and Cat Key, 2 on Exuma, 1 on Abaco, and 5 cases with the locations pending. A further breakdown of the cases on the COVID-19 dashboard indicating 33 of those newly infected on New Providence have a history of travel. So did 3 of the cases on Grand Bahama and the lone case on Abaco. Total cases in country surpassing 24,000, with 24,269 confirmed cases in country since March of 2020. 1,574 cases are active, 22 of them in hospital, 20 moderately ill, 2 persons in intensive care at this time. Now, health officials also reporting 3 COVID-19 related deaths, all of them residents of New Providence. The oldest, a 60-year-old female who died on December 24th, a 42-year-old male who died on December 20th, and a 54-year-old male who died on Tuesday. These deaths push the COVID death toll to 716. 38 deaths remain under investigation. A total of 28 people were reported recovered. Total recoveries now at 21,789. The government is watching the U.S. Centers for Disease Control and Prevention's recommendations when it came to the United States quarantine time, with individuals presenting asymptomatic for COVID-19. Health and Wellness Minister Dr. Michael Darville telling reporters as much on Tuesday. Earlier this week, the CDC announced that given what is currently known about COVID-19 and the Omicron variant, it is shortening the recommended time for isolation from 10 days for people with COVID-19 to 5 days if asymptomatic, followed by 5 days of wearing a mask when around others.
We are watching the CDC recommendations, and much discussions is going on, particularly with our first responders. It's very difficult in our hospital to have the bulk of the staff out when there's a possibility to bring them back in earlier. Likewise, for our police officers, our immigration officers, our custom officers, All of these individuals are necessary for the country to function. So we're looking very closely at the new CDC guidelines, and we will definitely have to take into consideration what is happening around the world and begin to adjust our protocols to what is going on. The government free testing program is actually being assessed. We are planning to activate free pilot testing programs here in New Providence, which appears to be the epicenter of the Omicron variant. Those free testing programs are about to take place. Hopefully we'll get them in order this week. They will be at our centers where we are vaccinating, so there'll be free testing, free mask giveaways, as well as vaccinations, all going on simultaneously across New Providence.
According to the CDC's director, Dr. Rochelle Walensky, on CDC's website, it's also being recommended that people who test positive should isolate for 5 days, and if asymptomatic at the time, they may leave isolation if they can continue to wear masks for 5 days to minimize the risk of infecting others. Additionally, the CDC is updating the recommended quarantine period for those exposed to COVID-19, the unvaccinated, or those more than 6 months out of their second dose or more than 2 months after the Johnson & Johnson vaccine and not yet boosted. Is now recommended that they quarantine for 5 days, followed by strict mask use for an additional 5 days. Alternatively, if a 5-day quarantine is not feasible, it is imperative that an exposed person wear a well-fitting mask at all times when around others for 10 days after exposure. Individuals who have received their booster shot do not need to quarantine following an exposure, but should wear a mask for 10 days after exposure. For all those exposed, best practice would also include a test for COVID at day 5 after exposure. If symptoms occur, individuals should immediately quarantine until a negative test confirms symptoms are not attributable to COVID-19. Now, Dr. Darville also gave reporters an update on where the government's at with free testing for New Providence residents.
If you look at the Delta variant, if you had about 300 people infected with the Delta variant, and there's about 10% who would be hospitalized, what we're seeing with the Omicron variant is a little bit different. And so our decisions are based on the evidence that is in front of us. When we say watching, it means that we need to see how the virus is panning out in our country, so our epidemiologists and our scientists can make policies around what we are experiencing as a nation. And so we are now about 5 days. We see the cases are spiking, and for that means we now are implementing new measures that we will be able to tighten mass gatherings, because the virus is highly transmissible, and the less people we have meeting together in large numbers, the less likelihood of the transmission to take place. Okay. And so we are doing what every country around the world is doing, creating policies that is reflective of the data in front of us.
Dr. Darville adds that there will be some PCR testing in the free testing program, noting that the methodology as well as the protocols for when free testing PCR tests will be implemented, along with the rapid antigen tests, are conditions being worked out and will be incorporated in the ministry's.
Well, first of all, we are pleased of what we've seen so far with the numbers to where they are today. We're hoping and praying that what is happening across the globe is going to be reflective of what's going on in the Bahamas. But with that being said, we are making the necessary preparations in the event that we do see a surge of individuals coming to our emergency room, and the ability to prevent bottlenecks and provide appropriate measures so that we can take care of individuals who do have issues as it relates to the COVID virus.
Nurses at the Princess Margaret Hospital are now forced to work overtime as a result of healthcare staff either testing positive or COVID-19 or being exposed to someone who has. This much coming from Bahamas Nurses Union President Amanda Williams. Now, to combat the strain on healthcare facilities, Health Minister Dr. Michael Darvol says this afternoon that 12 new doctors and 50 new nurses are set to be hired next week. But the BNU president says that the 170 new nurses promised by the former administration have not arrived as yet and would require some training before they're allowed to work. Hence why many nurses are picking up extra hours to fill in the gaps until then. Now, there has been some issues in the past where funds accumulated for overtime or increments promised by the government haven't been received in a timely manner, resulting in a widespread sick-out or some form of industrial action. Asked what the union plans to do if there's a reoccurrence, the union president says the union will be giving the government until January to satisfy their needs. Otherwise, the union is prepared to take to the streets once again. You're watching JCN News. Stay with us.